EMT Prometric questions and answers. Questions 71 to 90. 71. During your initial assessment of an unconscious adult patient, you find the patient is apneic. You should next: A. Assess for a carotid pulse. B. Begin chest compressions. C. Deliver 2 rescue breaths. D. Place an oropharyngeal airway. The answer is C. Deliver 2 rescue breaths. 72. A 6-year-old male, who weighs 40 pounds, ingested a bottle of aspirin approximately 20 minutes ago. Medical control orders you to administer activated charcoal in a dose of 1 g/kg. How much activated charcoal will you administer? A. 12 g. B. 14 g. C. 18 g. D. 24 g. The answer is C. 18 g. 73. Upon delivery of a baby's head, you see that the umbilical cord is wrapped around its neck. You should manage this situation initially by A. Clamping and cutting the umbilical cord. B. Gently pulling on the cord to facilitate removal. C. Trying to remove the cord from around the neck. D. Keeping the cord moist and providing rapid transport. The answer is C. Trying to remove the cord from around the neck. 74. You arrive at the scene shortly after a 3-year-old female experienced a seizure. The child, who is being held by her mother, is conscious and crying. The mother tells you that her daughter has been ill recently and has a temperature of 102.5 degrees Fahrenheit. What is the most appropriate treatment for this child? Oxygen via pediatric nonrebreathing mask. Place the child in a tub of cold water to lower her body temperature and transport. Oxygen via the blow-by technique. Remove clothing and cool the child with towels soaked in tepid water and transport. Oxygen via pediatric non-rebreathing mask. Avoid any measures to lower the child's body temperature and transport at once. Oxygen via the blow-by technique. Transport at once and request a paramedic rendezvous so that an anticonvulsant drug can be given. The answer is B. Oxygen via the blow. 75. You receive a call to a local daycare center for a 3-year-old boy who is not breathing. When you arrive and assess the child, you find him to be in cardiopulmonary arrest. You initiate CPR and request a backup ambulance. As you are performing one rescuer CPR, your partner prepares the AED. The appropriate compression to ventilation ratio for this child is A. 3:1. B. 5:1. C. 15:2. D. 30:2. The answer is D. 30:2. 76. You receive a call to a local daycare center for a 3-year-old boy who is not breathing. When you arrive and assess the child, you find him to be in cardiopulmonary arrest. You initiate CPR and request a backup ambulance. After attaching the AED, you push the Analyze button and receive a shock-advised message. After delivering the shock, you should A. Assess for a carotid pulse. B. Immediately perform CPR. C. Reanalyze the cardiac rhythm. D. Open the airway and ventilate. The answer is B. Immediately perform CPR. 77. You receive a call to a local daycare center for a 3-year-old boy who is not breathing. When you arrive and assess the child, you find him to be in cardiopulmonary arrest. You initiate CPR and request a backup ambulance. A paramedic unit arrives at the scene to provide assistance. After one of the paramedics intubates the child, you should deliver ventilations at a rate of A. 6 to 8 breaths/min. B. 8 to 10 breaths/min. C. 10 to 12 breaths/min. D. 12 to 20 breaths/min. The answer is B. 8 to 10 breaths/min. 78. You receive a call to a local daycare center for a 3-year-old boy who is not breathing. When you arrive and assess the child, you find him to be in cardiopulmonary arrest. You initiate CPR and request a backup ambulance. In infants and children, the most detrimental effect of gastric distention is A. Increased ease of ventilations. B. Decreased ventilatory volume. C. Acute rupture of the diaphragm. D. Less effective chest compressions. The answer is B. Decreased ventilatory volume. 79. Which of the following parameters would be most reliable as an indicator of perfusion in a 1-year-old child? A. Heart rate. B. Capillary refill. C. Blood pressure. D. Respiratory rate. The answer is B. Capillary refill. 80. While managing a patient with acute shortness of breath, you prepare and apply a non-rebreathing mask set at 12 liters per minute. The patient pulls the mask away from his face, stating that it is smothering him. You should next A. Increase the oxygen flow and reapply the mask. B. Securely tape the oxygen mask to the patient's face. C. Reassure the patient and apply a nasal cannula instead. D. Inform the patient that refusing oxygen might result in his death. The answer is C. Reassure the patient and apply a nasal cannula instead. 81. Signs of inadequate breathing in an unconscious patient include A. A fast heart rate. B. Warm, moist skin. C. Equal breath sounds. D. A rapid respiratory rate. The answer is D. A rapid respiratory rate. 82. Initial attempts at providing artificial ventilation should be accomplished using A. The one-person bag valve mask technique. B. The two-person bag valve mask technique. C. A pocket mask with supplemental oxygen. D. A flow-restricted oxygen-powered ventilation device. The answer is C. A pocket mask with supplemental oxygen. 83. The most effective means of preventing the spread of disease is A. Effective handwashing. B. Up-to-date immunizations. C. Wearing gloves with all patients. D. Wearing a mask with all patients. The answer is A. Effective handwashing. 84. You have completed your pre-hospital care report and left a copy at the hospital when you realize that you forgot to document a pertinent finding on the front of the report. Your most appropriate action would be to A. Attach an addendum to the original run report. B. Write the information on the original run report. C. Complete a new run report and add the information. D. Take no action and report the event to your supervisor. The answer is A. Attach an addendum to the original run report. 85. An awake and alert 92-year-old woman with chest pain is refusing EMS treatment and transport to the hospital. Her family insists that you transport her. This situation is most appropriately managed by A. Transporting the patient as the family wishes. B. Advising the patient of the risks of refusing care. C. Obtaining a signed refusal from a family member. D. Transporting the patient as you explain your actions. The answer is B. Advising the patient of the risks of refusing care. 86. At the scene of a mass casualty incident, you notice a bystander who is clearly emotionally upset. An appropriate action to take would be to A. Tell the bystander to leave the scene at once. B. Have the bystander assist you with patient care. C. Notify the police and have the bystander removed. D. Assign the bystander a simple, non-patient care task. The answer is D. Assign the bystander a simple, non-patient care task. 87. Which of the following situations would necessitate treatment using implied consent? A 16-year-old pregnant girl with an isolated extremity injury. An 18-year-old man who is now alert after receiving oral glucose. A 25-year-old man who is restless and has severe chest pain and diaphoresis. A 65-year-old man who is semi-conscious and suspected of having a severe stroke. The answer is D. A 65-year-old man who is semi-conscious and suspected of having a severe stroke. 88. Which of the following patients would most likely present with atypical signs and symptoms of acute myocardial infarction? A 72-year-old female with diabetes and hypertension. B. 64-year-old male with renal disease and depression. C. 59-year-old male with alcoholism and angina pectoris. D. 55-year-old female with COPD and frequent infections. The answer is A. 72-year-old female with diabetes and hypertension. 89. While assessing a patient with chest pain, you note that the patient's pulse is irregular. This most likely indicates A. Acute myocardial infarction or angina pectoris. B. A dysfunction in the left side of the patient's heart. C. High blood pressure that is increasing cardiac workload. D. Abnormalities in the heart's electrical conduction system. The answer is D. Abnormalities in the heart's electrical conduction system. 90. While a man was using a chainsaw to trim branches from a tree, it slipped and caused a large laceration to his left forearm. Bright red blood is spurting from the wound. The patient is conscious, alert, and talking. You should first A. Open the patient's airway. B. Control the active bleeding. C. Apply supplemental oxygen. D. Thoroughly cleanse the wound. The answer is B. Control the active bleeding.